India has survived epidemics before. From plague to polio to COVID 19, the country has learned painful lessons about disease, delay, and denial. But the next health crisis may not arrive with empty streets or emergency announcements. It may spread quietly, undetected, underestimated, and already too late to stop. Today, we look at three deadly infectious threats India is still not fully prepared for: Nipah virus, Zika virus, and drug resistant tuberculosis. These are not future possibilities, they are real, present, and growing. Nipah virus, the outbreak that comes from the shadows. Nipah virus is one of the most lethal viruses known to science. In past outbreaks, fatality rates have reached 40 to 75%. The virus originates in fruit bats, spilling over to humans through contaminated food or direct contact. In some cases, it spreads from human to human, particularly in hospitals and households. India has already faced Nipah outbreaks, especially in Kerala. Each time, swift action prevented disaster, but only after patients reached critical condition. That delay is the danger. Early Nipah symptoms look ordinary: fever, headache, body pain. By the time brain inflammation begins, survival chances drop sharply. There is no specific antiviral treatment, there is no widely available vaccine. Detection depends on rapid surveillance, advanced laboratories, and early reporting, systems that remain uneven across India. With climate change, deforestation, and increasing human-animal contact, Nipah is no longer rare. It is a warning of what unchecked spillover can do. Zika virus, the threat you don't see coming. Zika virus does not usually kill. That is why it is so dangerous. Most infected people have mild symptoms or none at all. But when Zika infects pregnant women, it can cause severe birth defects, including microcephaly, a condition where babies are born with underdeveloped brains. Zika spreads through Aedes mosquitoes, the same ones that spread dengue and chikungunya. India already struggles with mosquito control. Now consider this reality. Many infections go unnoticed. Testing is limited. Pregnancy-linked surveillance is weak. Urban overcrowding accelerates spread. Zika does not overwhelm hospitals. It quietly reshapes lives before the damage is even detected. Without strong maternal screening and vector control, Zika becomes not a short outbreak but a long-term social crisis. Drug-resistant tuberculosis, the crisis already killing. Tuberculosis is often seen as an old disease. That perception is dangerous. India carries the highest TB burden in the world, and an increasing number of cases are now resistant to standard antibiotics. Drug-resistant TB develops when treatment is delayed, incomplete, or misused, often due to poor access, misinformation, or weak follow-up systems. The result is a form of TB that requires years of treatment, uses toxic, expensive drugs, has lower cure rates, spreads through the air like ordinary TB. This is not a future threat. Drug-resistant TB is already killing thousands every year, silently, slowly, and disproportionately among the poor and undernourished. Because it lacks dramatic outbreaks, it rarely dominates headlines. But it is one of India's deadliest ongoing health emergencies. Why India remains vulnerable. India has skilled doctors, advanced laboratories, and a powerful pharmaceutical industry. But outbreak control depends on systems, not heroism. India still struggles with delayed disease detection, uneven laboratory access, overcrowded hospitals, weak rural healthcare coverage, underfunded public health surveillance. Outbreaks do not fail because doctors fail. They fail because early warnings are missed. Nipah tests, outbreak readiness. Zika tests, surveillance and maternal health care. Drug-resistant TB tests, long-term commitment. These diseases do not announce themselves, they wait. And the greatest danger is not the virus, but the moment we realize it too late.